Hello, good morning or good afternoon. Julia Pietsch speaking here from Germany Trade and Invest. Welcome to our webinar. We will start in just a few seconds. We see more and more people dialing in, so we just let a few seconds pass to let everybody get ready, and then we will start in a few seconds. So we see more and more people coming in. I hope everybody has a coffee, something to drink, so that we can start. We have about 160 registrations from all over the world, from Japan, from Italy, from Austria, Switzerland, from all parts of Europe, Korea, Portugal, Egypt even, and India and China. So nearly every part of the world is listening or has at least registered to listen in later. So we can really say that we have a quite international audience today. So we have about 80 participants right now. So I think we can start at this point. I guess more people coming in while I speak. So yeah, warm welcome again from my side. My name is Julia Pietsch. I work for Germany Trade and Invest, and we are happy to have you all here for our webinar, Succeed in Germany's Digital Healthcare Market. Let's meet at DMEA 2023. We have wonderful speakers today, which I will introduce to you. You see them already here. They have their camera on and they are ready to give their presentations. I'm your host today, your moderator, and I'm also having the pleasure to be your first speaker today. I will talk about the work of Germany Trade and Invest and also about the Germany's digital health market. We also have Johannes Ruppert here from bvitg, the German Association for Health IT Vendors. He will speak about the association and its work and also about new regulatory topics in German digital health, the new digital health strategy, for example. And last but not least, I'm sorry, we have two ladies here from the Messe Berlin, which is the organizer of the DMEA, Andrea Hillmann and also Karoline Werfel. They will speak about the international program of DMEA and also the program for startups at DMEA. So we have a quite interesting program today, many things to talk about. So let's start with my part. Maybe before I dig into all of our topics, I'm sorry, I just messed up my presentation here, but bear with me. I will show you my first slide. Before I start with all of the topics, let me just quickly say we have about an hour today, and we will have enough time for questions and answers at the end of this webinar. You are mute right now, but you still have a voice. You have the opportunity to post your questions in the chat feature. You should see on the right, there's a chat panel, chat feature where you can post your questions or if you have something else to say, and we do our best at the end of this webinar to answer all your questions. If we don't have the time to answer all of the questions, then we will do that after the webinar. So please don't be shy, put your questions into the chat feature and we will address them at the end of this webinar. So with that, I can start with my part. Let me just briefly describe to you what Germany Trade and Invest is for those of you who are not familiar with what we are and what we do. So we're the Economic Development Agency of Germany. Just so I can see my own presentation. We are based in over 50 locations all over the world. So we are here in Berlin, but also present in Bonn, And you can find colleagues of mine nearly in every part of the world if you need our support and assistance. We have 4 main tasks. So we promote export. We help the German economy to go abroad, but we also help international companies to set up their company, their office in Germany, and really enter the German market. We market Germany as a location for business, but also for research and development. And we also support the new federal states of Germany, and especially those areas that are impacted by the so-called structural transformation in Germany. So quite a lot of things to do for us. I'm part of the healthcare team and the department for investor consulting. And I guess many of you are interested in how we can support you and your company to set up your office in Germany. We have a broad service package for you that's free of charge. And we always start with market and industry information because, of course, especially in healthcare, it's important to really understand the market, understand the rules of the market, how the market functions, understand who are your customers here in Germany, who might be relevant partners, how do you get information about the statutory health system or certification and reimbursement in Germany. These are all topics that we cover and that we can support you in understanding. We also help you with finding out how to set up an office in Germany, to form a company in Germany. So for example, what are the different company forms in Germany? How do I pay taxes in Germany? What about labor law? These are all information that we can provide to you. And of course, we also help you with information regarding funding and financing in Germany. And again, in healthcare, it's really important to also find the right partners, hospitals, for example, to do your pilots here in Germany, your studies here. And we help you in finding your partners. We don't do that all alone. We work together with the 16 states. They all have their agency, their federal agency. And we all also work together with the so-called life science or medtech clusters in Germany. So everywhere in Germany, in nearly every state, you find a cluster. And in these clusters, you find university hospitals, other companies, and agencies that can support you in understanding the market, the region, and of course, finding partners that can help you to enter the German market. We have a new fact sheet that explains where these clusters can be found and what they do. I tried my best to make that visible, but I also put you the link here so you can directly go to our website and download this fact sheet and see for yourself what these clusters have to offer. And we have a really good network in healthcare around Germany, and we're happy to connect you to these resources. With that, I would like to highlight some of the key points of healthcare in Germany for those of you who are completely new to this topic, so we are all on the same page. Just briefly, here you have all of the important key facts that make visible how big the German healthcare market is. We spend nearly 500 billion euros per year on healthcare, which accounts to 5,600 euros per capita spending. 90% of our population has public health insurance. We have about 1,900 hospitals with more than 500,000 beds. We have 18,000 pharmacies, and not to forget, healthcare is also an important job market in Germany. 7.5 million people are currently employed in the German healthcare industry. So here you see how healthcare insurance works in Germany. Health insurance is mandatory in Germany. As I said, the vast majority has public health insurance, and about 10% have private health insurance in Germany. If you have public health insurance, you can choose from a little less than 100 public health insurance companies, and we also have about 40 private health insurance companies. We get a lot of requests regarding the hospital market in Germany, of course, how to get in touch with them, how many hospitals do we have, how many special hospitals we have in Germany, how the whole system functions. So here, just briefly mention that we have about 1,900 hospitals in Germany. They are either public, privately, or charity based. And on the right side here, you see that the share of privately owned hospitals is increasing in Germany at this point. Some of you might be not familiar with the fact that Germany is a quite old population. Germany is the oldest population in Europe and the second oldest population in the world after Japan. Of course, regarding healthcare, more challenges come along with that. We also see the number of people that are care dependent increasing in Germany. We have more people that have multiple diseases at the same time. And this is also one reason why digital health is so important also for Germany to at least face some of these challenges. So the next topic, of course, will be digital health. To dig a little deeper into this topic, here I show you the predicted market volume for Europe. So you have an idea how big the market is in Europe and also in Germany. And we see the market volume steadily increasing in Germany. And why is that? So we have to understand this, we have to go back in time a little bit. So even already in 2018, the German Ministry of Health has pushed forward a great amount of legislative action to digitize the German healthcare system. And in 2019, it passed the so-called Digital Health Act or Digital Healthcare Act to accelerate digitization and innovation within the German healthcare market. And the act also paved the way to reimburse digital health applications. We call them DiGAs here. And all of these regulatory steps, they really open up the digital health market in Germany and made digital transformation at least possible in Germany from a regulatory side. Of course, this has been going on for many years now, and now we want this digital transformation to further develop and to go on, of course. Now, after the pandemic, after we have learned everything about how digital applications can make healthcare better, improve it, and make it better. Johannes will, in a few minutes, dive deeper into the regulatory topics of digital health, and will show you what is planned regarding also e-prescription, telemedicine, and the electronic patient record. But let me just briefly touch upon the DiGAs, because we get so many requests regarding the process of how to get into the so-called DiGA directory and what are DiGAs and is this a path for me to enter the German market. So let me just briefly address what are DiGAs. DiGAs are medical products, class 1 or 2A under the current MDR. And their main function has to rely on digital technologies, and the intended use has to center around the patient. And here you see the so-called fast track that the Federal Institute of Drugs and Medical Devices has installed for DiGAs to enter the statutory health market. And this is just another example where we can support you in understanding a market entry strategy for you. So we provide you with the information about this fast track. We can provide you with information so you can already understand if your product, your medical app that may function in many other markets around Europe or around the world is also eligible for this DiGA directory here in Germany, because if your app is in the DiGA directory, it can then be prescribed by doctors and be reimbursed by all of the nearly 100 health insurance companies in Germany. Again, we're happy to help you to get through this process, to understand it, and to find the right resources to answer your questions. So one good start, of course, is coming to Germany, visiting Germany, and getting around, getting to know companies that, for example, have already made it into the directory, that are health application providers. DMEA is one great opportunity to understand this market, to meet the players, potential partners, and customers. We will also be at DMEA, no surprise. Yeah, I forgot to show you this. We have currently 44 medical apps in the directory. So just to give you an idea of what this looks like. And here you see the medical disorders that are already addressed by apps that are currently in this DiGA directory. And again, DMEA is a great place to meet the providers of these apps. And you can also meet us, as I said, to discuss all of these topics and get familiar with the German market or other European markets. We will host a panel at DMEA. It will take place on the Wednesday of DMEA, the 26th of April. And on this panel, we will have representatives from Israel, from France, from Denmark, from Finland, and the Netherlands. And they will discuss their digital health topics and current developments, and also share their experience regarding international cooperation and exchange. So you will hear more about DMEA, the international program, and the startup program in a second. But at this point, let me hand over to Johannes Ruppert from bvitg, and he will now tell you more about the regulatory updates and current developments in digital health. So Johannes, the stage is yours. Please show us your presentation.
Thank you very much, Julia. I hope everyone can see and hear me, and let's see if we can start with the presentation.
Looks good.
Okay. So, welcome everyone from the bvitg. My name is Johannes Ruppert, and I work in the politics department. And yes, our motto is "We create digital health." So, okay, I cannot see my presentation anymore. 1 second, please. Here we go. So, what does the bvitg do? What does bvitg mean? We are the Federal Association for Healthcare IT in Germany, and since 1995, the voice of the manufacturers of information and communication systems for the healthcare sector in political Berlin, and of course also to the regional capitals in Berlin, in Germany. And we are one of the major and main contacts for this health administration in the healthcare sector. Important for us, and one of our goals, is to organize networking and to be an exchange platform for all our member companies. And of course, we are the organizer of the DMEA with the support, for example, of the Messe Berlin. Now I will talk about some numbers, dates, and facts regarding the association, our purpose, our mission statements, a little bit about how the association works. It's a lot about cooperation and, of course, engagement. And when we will come to the current regulatory updates from the German federal government, which is the Digitalisierungsstrategie, strategy about digitalization, which has been published very recently. So the bvitg was founded in 1995. As of February 2023, we have 114 member companies. They are organized in 12 task forces, 6 project groups, and 2 expert pools. One of the expert pools, for example, focuses on artificial intelligence. We have 6 honorary board members, and we have 46 honorary task force and project group leaders. So you can already see that an important part of association work is the engagement of the member companies. We also have 20 full-time staff members here in Berlin, and one feel-good manager, which is his name is Fritz Walter, after a famous German soccer player, a football player, and he is the dog of our boss. We have also an intranet, which has 1,076 users, and through the internet, the biggest part of the association's internal communication is displayed. So what is the purpose, or what are we actually doing in the bvitg? The bvitg is committed to sustainably improving healthcare for people in Germany through the use of innovative and practice-oriented IT solutions. And we represent the interests of the leading IT providers in the healthcare sector, whose products are used in the outpatient and inpatient sectors, as well as in rehabilitation care and social institutions. What are our principles? What are our mission statements? And how does this affect our daily work? So the bvitg itself draws its expertise from a diverse range of member companies. That, for example, also means that we will not represent only the position of a single member company, but we will always try to find the consent of the industry. The bvitg represents the interests of providers of digital solutions in the healthcare sector. So to become a member at the bvitg, you obviously would have to be in this area. The bvitg sees itself as the shaper of the digitalization of care processes. So we don't only focus on one part of the healthcare system, but we try to have an holistic approach. The bvitg advocates the use of international standards and interoperable data exchange, and this is especially important as many of the German regulations sometimes prohibit this, and we try to push here for international solutions. The bvitg is committed to secure access to and responsible use of data. As you probably know, data is a very sensitive subject in Germany, so we try to be on the good side here, of course. The bvitg takes a holistic view of patient care and takes into account all stakeholders. Very important, of course, for the presentation today, and probably also for you who are interested in the DMEA, is that the bvitg is the organizer of the DMEA and therefore creates participation opportunities for its members. And a general statement, which hopefully illustrates our position in general, is that the bvitg stands for free markets and, of course, for innovation, especially from the private sector. So how does this work in daily life? We have a couple of task forces. I already told you the numbers, and a lot of some project groups. And these, of course, are key to the association's work. They form the framework for cooperation and exchange of the member companies, and they are the right place for thematic dialogue and the development of the association's positions and legal commentaries and so on. And the cooperation in the committees creates the basis for the political and communicative work of the bvitg, which we will then present to political stakeholders, to the public, to the outside. The entire task force and project group communication of the bvitg is organized via the association's intranet. So general information and dialogue channel for the communication of member companies with each other, as well as with the staffed office, is the intranet, and it's used very actively, and it's also a good place to network pretty much. Member companies will not only find all dates and news from the committee's work, but also bundled information on the topics relevant to the industry in the intranet. Yes, and as you can probably tell by what I've told you before, I always have to repeat this because it's a very important part of the association's work, and an association lives from the voluntary commitment of its member companies and from the exchange among each other. So that much to the bvitg itself, and now we will have a short look on the current regulatory frameworks. So, Minister of Health, Professor Karl Lauterbach, presented on 9th of March 2023, so approximately 2 weeks ago, the the digital health strategy, and this is not a law but a strategy, and but it is considered an outline for at least 2 upcoming laws: the Digitalgesetz, the Digital Act, and the Gesundheitsdatennutzungsgesetz. It's a very long German word. Maybe one can remember this for Scrabble the next time. It's translated to the Healthcare Data Usage Act. So in addition to a vision and goals for the digitalization projects, the contents of a strategy also include some regulatory framework conditions and prerequisites for successful strategy implementation. We ourselves have been hoping for a very long time for such a strategy, as the digitalization of the German health market is an ongoing process, and of course we have been pushing very much for better results here for about 20 years at least. The strategy was created in a participative process. Many stakeholders had the opportunity to give inputs, for example, through roundtables. And of course, as you might have guessed, we were also one of the stakeholders. The existence of a strategy itself is already considered quite a big success actually. However, the question, especially from us, is raised how the strategy's contents will be evaluated. And from the strategy, the two acts which will follow in the next steps, the Gesundheitsdatennutzungsgesetz and the Digitalgesetz, are both expected to be published very soon. So the first draft probably already in the end of March and in the beginning of April. So at the DMEA, this will be out to the public and of course a big discussion topic. The contents of the digital health strategy include the EPA opt-out. So this is of course a very, very big topic for us. The EPA, which means in Germany, it's an abbreviation for elektronische Patientenakte, which translates to electronic health record, will be mandatory to some extent, according to the digital health strategy. Every member of the statutory or public health insurance, die gesetzliche Krankenversicherung, will automatically receive an EPA unless they choose to contradict. So this is the opt-out solution. This opt-out solution for patients was preferred by many stakeholders, as the already existing opt-in EPA is only used by 500,000 insurance members as of January 2023. The EPA will be published in the form of an app provided by the public insurance companies and downloadable from the App and Play Store. According to the ministry's timeline, 80% of statutory health insurance members, which would be roughly 60 million, will have the EPA at their disposal. So this would of course be a huge step, and the opt-out solution is of course also very popular with us. Other contents of the digital health strategy include that from 2024 on, e-prescriptions will be mandatory and exclusive. 500 million prescriptions are currently issued annually in Germany, but in 2023 so far, only 1 million e-prescriptions have been issued, and so this is quite a big step we're expecting in the next 9 months. Where also a very important point for us is that the 30% limitation on the billing option for telemedicine will be completely removed. As I talked a little bit about data regulation before, in the future, there will only be one state data protection officer who will look over medical products, and not 16 as of right now. And very important to us too is the strengthening of the research landscape. The political target here is that 300 projects are to be founded regarding healthcare data. And very important for us especially is that there will be access for health data for private research, which is restricted right now. So this is already the end of this little presentation, but of course, I once again want to mention the DMEA. The bvitg organizes a variety of events, but the most important one, obviously, is Europe's biggest trade fair in the e-health sector, the DMEA. And with this, I will end this presentation, and I will pass on to Julia once again.
Thank you, Hannes. Thank you for this presentation and all of these insights. Andrea and Karoline, I hope you're ready. And if you like, you can now share your presentation and tell us more about DMEA and the international program. Please go ahead.
Thank you, Julia. So I hope you can see now my presentation.
Yes.
Yeah.
We can
Yes.
see it.
Okay, great. Okay, so also a warm welcome from my side. My name is Karoline, and I'm one of the project managers of DMEA from Messe Berlin. And I'm responsible for the international exhibitors, international pavilions, and also for some of our focus areas, for example, the Focus DMEA Sparks. And this is my colleague, Andrea. She is responsible for our special focus areas like DIGA and mobile health, and she's also responsible for our huge startup area. I will give you now some short information about this event. So what is DMEA? DMEA stands for Digital Medical Expertise and Application. And as Johannes already said, it's Europe's leading event for digital health. It is a B2B trade fair with exhibition, congress, and many networking opportunities. And each year, DMEA brings together IT companies, institutions, and policymakers with potential customers, industry professionals, newcomers, young talents. So DMEA as a platform is connecting health IT. This year's DMEA takes place in about 5 weeks, from 25th to 27th of April, and our ticket shop's already online. And if you're interested in participating as an exhibitor, you already can save the date. Next year's DMEA will be from 9 till 11th April 24. Yeah, this year we are also have enlarged into 6 halls, and we are already fully booked. Last year we had about 4 exhibition halls. This year we are also very happy to welcome 70 national and international startups. It's more than the double of last year, and we expect around 12,000 attendees from 45 countries, of which are around 80% are decision makers. And our visitors include the top hospital management, and they are the CEOs and the IT staff of the healthcare sector. Later on, we'll give you a link where you can find our brief analysis of the DMEA visitors and exhibitors, where you can find it on our website. This year, we are also really happy because we have a new record of international pavilions. And we expect pavilions from Norway, Denmark, Finland, Latvia, Netherlands, Switzerland, Austria, Belgium, and Italy. So if you're interested to get in touch with exhibitors from these countries, their profiles and exhibitor entries are already online on our website and the DMEA platform, so you can get in touch with each other, and for sure you can make some appointments to meet up at DMEA. Yeah, what do we offer for international participants? All our Congress sessions and the whole program on our 2 Congress stages will be simultaneously translated into English, or there will be an original in English. And also exhibitors can visit the Congress with their fair passes. And we work together with Germany Trade and Invest and the Enterprise Europe Network. GTAI provides insights into the German health IT market like today, and Andrea already mentioned also program parts. And we also work together with the Enterprise Europe Network, EEN, which offers business meetings where you already can just register now to find your business match, and then you can meet at DMEA. It's like a networking event. Some program highlights for international visitors, for example, are the opening keynote, which will be held from the Federal Minister of Health, Professor Karl Lauterbach. And we also have some European topics, for example, the European data space and digital identities on the first day of the DMEA, and the digital health across borders experience from international delegation organized by GTAI. And furthermore, all exhibitors and visitors are invited to our networking events. We have the DMEA Afterwork event for networking on the first evening of DMEA, and it will be in the south entrance of the fairground. And we have the DMEA party in the club in Berlin on the second evening, where you can go further your appointments. And yeah, for further program highlights, you also can have a look at the program overview in our website. And now Andrea will tell you something about the startups.
Yes, thank you very much, Caro. I will be happy to take over. Yes, the legendary party. So it's a nice event. So I will start with some information about our startups. My name is Andrea Hillmann. I'm from the DMEA team, and as Caro said, among other things, I'm responsible for the startups and for the DIGA exhibitors you mentioned before at the DMEA on the exhibitor side. And together with a colleague from the bvitg, Tim Joel Rube, I think some of you will know him, some of the startups who are here will know him. I also support the startup lecture program, Start Me Up. I will tell you something about it later. This year, I'm very happy. This year, the interest of the startups who wanted to become exhibitors and co-exhibitors was overwhelming. We started with 33 in the after pandemic year 22, which was great already, but now we have over 70 national and international startups at the focus startups area, among others from South Korea with 5 startups and sensitive bed. They bring a bed with them by aeroplane. I'm very happy to see this. They come from France, from Great Britain, from Czech Republic, from Switzerland, Denmark, Lithuania, Netherlands, and of course, Germany. I hope I haven't forgot anyone. Austria, I forgot Austria, sorry. Yes, and many more startups, of course, are at the other international pavilions and at the other stands of great exhibitors. Some of them bring startup with them. By the way, You can find more details on the DMEA exhibitor overview on our website and on our online platform. We have compiled all these links on the last chart at the end of this presentation. So let me tell you something about our startup program. From mid-February until to the beginning of March, DMEA startups and also external startups who are no exhibitors could apply for the free DMEA format Start Me Up. Here too, the response was huge. We have about more than 100 submissions. At the time, an independent jury will review all the call for papers and select the best ones. We will have 5 Start Me Up sessions with all 35 slots at the DMEA main program, according to topics such as artificial intelligence, green health, DIGA of course, empowerment, cloud solutions, or telemedicine. And we have one wild card. This is the surprise session. By the way, you can find all the whole startup program on the DMEA website or in the DMEA platform. We are just working at the program content, so at the time you just find the information that there is a slot, but the content or the motto of the slots will follow soon. Yes, let me end my short presentation with the question, what do the startups expect from DMEA? I think our startups hope to meet here a lot of investors and business angels. We try to invite a lot of them, but also the big digital health players and at least hospital representatives. So I think I'm ready with my information. You can go to the last chart, Caro. Here you find an overview with all important links. If you have any questions regarding the program, the DMEA, and of course the startups, you can talk to us after the webinar, or you can put your questions into the chat. Thank you very much.
Thank you, Andrea. Thank you, Karoline, for all this information. We now still have time for questions. Now you have received a lot of information and maybe you need a second to digest this. But yeah, please use the chat tool to post your questions. We already have quite some interesting questions, relevant questions, and we will do our best to answer all of them. The first question, of course, always important and useful. Yes, this webinar is recorded and you will receive the link so you can look at it again and again if you want later. We also do that so yeah, participants from other parts of the world that are not in our timeline, our time zone can look at it later. And you can also receive the presentations, of course. That's no problem, right? We have some questions regarding DIGA and the DIGA Fast Track. And in my presentation, I think I didn't mention that on the websites of the BfArM, the Federal Institutes for Medical Devices and Drugs, you find a lot of information also in English. You find the so-called DIGA guidelines, which are already available in English. And there you can read about all of the requirements that your health app have to have. The fast track, how that works, and also you find contact information to get to get advice from the BfArM directly regarding this process. If you cannot find this, just write me an email and I send you the link. We make sure that you have everything that's available in English, in German, also available in English. Right. Johannes, maybe you have a good idea where to find the Digitalstrategie, the digital strategy. Maybe you have an idea where to find more information about this also in English. I would guess on the sites of the Federal Ministry of Health. Do you have a clue where you can find this?
As far as I know, the strategy has only been published in German so far, but I'm sure that there are some summaries on the Federal Ministry's website for sure.
Yeah.
And also, I think there have been a couple of newspaper articles, and there will be more press statements coming out also, not just from us, but from other associations in the next couple of days and weeks. The strategy itself, it has 44 pages, so it takes a moment to guess like the whole picture, and yeah.
Right. If you're interested in a German in an English summary, write me an email, and I will do my best to send out more information on this. This is also this will also be relevant for the next couple of weeks and months, of course. There was another question regarding the DMEA. Is there an online matchmaking platform available? During the presentation, we talked about, Andrea and Karoline talked about the matchmaking platform. Is anything available also online, Andrea, Karoline?
Yes, have a look at our DMEA online platform, plus.demea.de. There you can build your own or create your own account. And if your account is visible, you can connect to all other exhibitors or visitors who are on this online platform.
Great.
But if you mean a really matchmaking event, then we have several ones at DMEA, but on site, of course. But in this platform, you can find a lot of partners or buddies or companies and people you can connect with.
Thank you. Then we also have a question regarding the bvitg membership. Johannes, I guess that will be a question for you. There was a question about the price, the member price. Maybe if you're not able to answer this right now, maybe I will connect you later. So whoever is interested in becoming part of the bvitg, please let us know, and we will, or you can directly, you have the contact information of Johannes here. Post this question to Johannes, or maybe Johannes, you can rely a little bit on this if you like.
Well, I will not talk about numbers per se, but of course we would be happy to welcome any requests, and you can reach us, for example, under the contact data here, or reach out directly to Julia, and she will for sure forward any further information.
Right, because I see here the questions, and I see who posted this question, so I can directly get in touch with you after the webinar. We have another question regarding diggers. This is really an interesting topic for many people, I see. The question is, let me see here. The question was, is DIGA only for therapeutics, or will it include monitoring and assessment as well? I should have talked about DIGA a little bit longer, I think, because that's interesting for a lot of people, I guess. So right now, DIGA focuses on the patient, and a doctor, of course, can be included, but the idea is really to improve care for the patient. And if your health application is eligible to become a so-called DIGA or not, you have to fulfill many requirements that are just that just really basic requirements like data protection, security, and so on. But then there are also requirements that are related to, or that really improve healthcare for patients. For example, they can close gaps between primary and secondary healthcare. So you come out of surgery and you need physical therapy, and then while you wait for physical therapy, you can use an app, a software to train, to do exercise, so that you know, the gap until you see your real in-person physical therapist is not too long. That is just one example. So yeah, it's about digital therapy, but also monitoring, for example. But the patient always has to be in the center. So it cannot be just a software that helps the doctors to monitor their patients, but it is an app or a software that helps the patients. That is the key, I would say, the key requirement. And as I said, in this DIGA guideline, you will find more examples and a really, really good explanation for these requirements. So if you read this this guideline, you will really have all the information and can evaluate, or at least first evaluate, if your product is ready for this path. Okay, let me see if we have more questions here. I'm jumping a little bit from questions regarding regulatory topics and topics about the bvitg and DMEA. Is bvitg limited to German companies only? That's always an important question that we also get. Johannes, maybe you can provide an answer.
Well, some of our members are multinational companies, also quite big ones. I don't want to name anyone in particular, but you can, of course, find them on our website and on other places. But of course, as we focus on the German market, there is usually the requirement that you do business in Germany in the e-health sector in Germany. Yeah. We will see, of course, how the e-health sector transforms in the next couple of years. There's a lot of legislation going on European level, so maybe we will also open up in that direction. I hope this helps a little bit.
Thank you. I have another question for Andrea or for Karoline. How do we best prepare as an international startup for DMEA? What should we bring? Any information that German partners in particular are interested? So really good question. Looking at it from the other side, what should they bring to DMEA, or what should they prepare for to make best use of DMEA in their visit?
First of all, mea culpa, I forgot Finland, and I think I mentioned France. No, I didn't. I did not mention France, but they are on the chart. So sorry. Living Skills from Finland and Tech to Heal from France are part of the DMEA startup area. This is advertising for you. Okay. What should they bring? As we have a turnkey ready startup area, they just have to bring good ideas, very good ideas, their laptop and people from that country. And maybe you should prepare and have a look into the German healthcare market and into the needs of the German healthcare market. I think this is enough, and you can import your ideas into the startup pitches. I hope some of the startups which take part get a pitch. And in the other forms, try to connect to people, try to connect with the stakeholder of the hospitals. Maybe you can get a date in a hospital after this, and that's all. I think it's important to know how the German market works, wie der Markt tickt, as we say in Germany, and motivation. And that's all, I think.
Motivation.
Yes.
Great. Yeah. When we talk to companies, small or big, they of course want to understand how we can support them, how to get around in Germany, and we always say, well, at least at some point you should come to Germany, visit visit here and see how everything works, talk with the important key players. And I think trade show, congress sessions like DMEA are a great place to get around. And DMEA is really focused on digital health, which makes it easy to go around and really meet nearly everybody that's relevant in this sector, right? It's not a huge healthcare show. It's a really focused digital health show, and that makes a lot of sense to get around. Everybody that's relevant is here, and no matter if you're a big company or a startup, that's the place where you can meet us. We see ourselves as the first point of contact to then show you who's relevant in this field, but then also meet the hospitals, meet maybe even health insurance companies, meet other companies, and see the challenges and the opportunities of companies here in Germany and internationally that come to DMEA.
Yes, and of course, as we have all the stakeholders there in digital health, all the great companies, the market leader, it's very important to connect, to visit the market leaders, to connect with them.
Right. Can only underline this.
Yes.
I have another question. I'll just look at the time. We still have a couple of minutes. So, Johannes, there are two questions relating, it's one question, but two people posed this question, really important question, regarding telemedicine. You mentioned the removal of the 30% limit on billing options for telemedicine. Can you please elaborate what does this mean?
Yes, so we had this limitation, which was raised every couple of years till now. Of course, telemedicine is quite a new subject, and so it was also new to the German legislation. It became a bigger topic during the COVID times, of course. And right, to this day, till now, there is a limitation in the billing regarding the insurance companies, but this will be lifted with the new laws, which we are expecting in the next couple of weeks. And also this, of course, regards the rural areas where maybe sometimes not so many doctors' offices and practices, and so this is also the thought of making healthcare more accessible to the rural areas. And so this was quite something we fought for. We are very happy about this, and yeah, we are excited to see how it will be written down in law, since this is only in the strategy until now. But yeah.
When the pandemic hit Germany, it looked like even the toughest critics of using telemedicine and the toughest data protection critics understood that it makes a lot of sense to use more telemedicine in Germany, and to let the people stay at home and communicate to their doctors online. And we saw a lot of companies from Austria, from Switzerland, from the Nordic countries coming to Germany and expanding their business to the German market, because there was such a hype. And when it was restricted, maybe you should also understand it's not that everybody in Germany was against using telemedicine or the doctors were against it. It was just that there was some some thoughts about, hey, do we really do something good for our healthcare system if the people only see each other online? And there was some hesitation regarding the question, is that really good? Then we had the pandemic, and we saw a lot of advantages of telemedicine, of course. And even a few years ago, it was really common that small hospitals, big hospitals were connected via telemedicine. We have teleconsultation between doctors. So this was already in place many years ago. It was more about seeing as a patient seeing doctors online. And so, as Johannes said, the restriction were lifted time and time again. And yeah, that there we see really the development in Germany, that more and more people are using this, more and more doctors are getting used to using it, and really also putting that as a service in their portfolio for their patients. I think we have time. Well, we're done actually, but there's one question, and with that I will just end our presentation because it's really important. We are interested to have a market analysis on the German healthcare market. You mentioned that Germany Trade Invest can help with this. How can we proceed afterwards? A really good closing question. You have all our addresses here. You have my contact information. I still have no question gets lost. I have all the questions here. I have your names here, and I will, after the webinar, during the next days, get in touch with you to discuss everything that we didn't have time to discuss at this point. Let me just finish by saying thank you for participating. Thank you to all of our great speakers. Thank you for my great colleague Katrin in the back. She puts everything together that you see here. She has our back if something technical is happening. I thought that this was a great webinar, and I hope that we see more of that in the coming months. And I hope that we all see each other at DMEA coming up in a few weeks. And with that, I will say goodbye to you for now. Thanks for listening, and see you next time, or see you at DMEA. Bye.
Thank you very much.
Bye. Thank you.
Bye.
See you.